Kia ora everyone, this is almost everything you'll need to know about the foot. We'll start with the sole of the foot and move our way back up. The sole of the foot contains many muscles, but they're split into 4 layers, and each layer contains no more than 3 muscles, so that makes it easier for us to remember. Before we look at the muscles, we'll see how they're laid out. The first 3 layers have 3 components, and the last layer consists of one group of muscles that is divided into 2. The last layer is the deepest, which is the interosseous layer, because you can't get any deeper than between the bones. And just as in the hand, there are 2 groups of interosseous muscles, the plantar interossei, which are the adductors, and the dorsal interossei, which are the abductors. So the pad and dab rules continue to apply, and we'll see that so do the other rules of the interossei we learned in the hand. Returning to the first layer, the key thing to remember is that the middle muscle, the one occupying the central compartment, if you like, is the flexor digitorum brevis, which I've drawn in an unfortunate colour. It occupies a central position, and it is flanked by the other muscles in the layer, which are abductor hallucis for the big toe and abductor digiti minimi for the little toe. So a central flexor and 2 flanking abductors. The second layer consists centrally of the tendon of flexor digitorum longus. Flexor digitorum longus is one of the muscles, of course, that we saw in the deep posterior compartment of the leg. So its tendon occupies the central position in the second layer, and the other muscles in the layer are attached to the tendon. So distally are the lumbricals, just as we had in the hand, and proximally is a muscle called quadratus plantae or flexor accessorius, whose job is to help redirect the pull of the tendons of flexor digitorum longus to which it's attached. So the second layer, the tendon of flexor digitorum longus and muscles that are attached to that tendon. The third layer forms a complementary set, if you like, with the first layer. So whereas the first layer had a central flexor and 2 flanking abductors, the third layer has a central adductor, which is adductor hallucis, and 2 flanking flexors, which is flexor hallucis brevis and flexor digiti minimi brevis. So just to repeat, layer 1 had a central flexor and 2 flanking abductors. Layer 3 has a central adductor and 2 flanking short flexors. So that's how the layers of the sole of the foot are arranged. Let's actually have a look at them now. So here we have the first layer, which is, as advertised, the flexor digitorum brevis muscle, flanked by abductor hallucis and abductor digiti minimi. These muscles have a more or less common point of origin on the tuberosity of the calcaneus here, attached to either the medial or lateral tubercles, or in between them, as you'd expect. Flexor digitorum brevis attaches distally to the bases of the intermediate phalanges of the lateral 4 digits. It splits to allow the longer tendon of flexor digitorum longus to pass through it. And the abductors attach distally to the bases of the proximal phalanges, medially on the great toe and laterally on the little toe, so that they abduct their respective digits. As in the hand, this area, the base of the proximal phalanx of the digits, is a common attachment site for the short muscles. On to the second layer, and the tendon of flexor digitorum longus, travelling from the deep posterior compartment of the leg around the medial malleolus and into the sole of the foot, and the muscles attached to it, quadratus plantae, here from the plantar surface of the calcaneus, just distal to and superior to the tuberosity, and attaching to the posterolateral margin of the tendon of flexor digitorum longus, and the lumbrical muscles attaching from the individual tendons, or extending from the individual tendons to the extensor expansions of each of the digits. So you just have to imagine them attaching on the other side, on the extensor surface, to the extensor expansions, just as the lumbrical muscles did in the hand. The third layer, where centrally we have Adductor hallucis, which is a two-headed muscle. It has an oblique head, which is attached to the bases of the second to fourth metatarsals here. It's also showing a wee slip here from the cuboid. And a transverse head from the plantar ligaments of the head region of the metatarsals. We're showing the one from the fifth here, which is most prominent, but there are also slips from the other metatarsophalangeal joint areas. And this muscle is very characteristically shaped, especially in the right foot. It looks like a 7, the number 7. In the left foot, it looks like a back to front 7. And so it's relatively easily identifiable. And both those heads attached to the lateral side of the base of the first proximal phalanx, which isn't actually that well shown here, but that's what it says in your books, so it must be true. So that's the central adductor. The flanking short flexors are Flexor hallucis brevis, which arises from the plantar surfaces of the cuboid and cuneiform bones here, and splits into two tendons that attach via sesamoid bones to the flexor aspect of the base of the proximal phalanx. And finally in this layer, the other flanking flexor, which is Flexor digiti minimi brevis, which attaches from the base of the fifth metatarsal up to the base of the proximal phalanx in a relatively straightforward fashion. Moving on now to the final layer, the interosseous layer. Before we consider the muscles, it's just worth looking here at the lovely tendons. We have fibularis longus here and tibialis posterior, this very splayed out tendon attaching to most of the small bones on the sole of the foot. Even has an attachment to the sustentaculum tali here. And you can see that these two tendons act as a stirrup to help support that medial longitudinal arch and also the transverse arch of the foot. But looking now at the muscles, we see the plantar interossei, the adductors. There are 3 of them. They are unipinnate, so they obey the palm tree rules that we established in the hand. And they attach to the bases of the proximal phalanges of the lateral 3 toes medially. Unlike the hand, the axis of abduction-adduction is through the center of the second ray, not through the third. So when we look at the dorsal interossei, the abductors, we see that these are 2-headed muscles, bipinnate, and they attach to the lateral sides of the bases of the second to fourth proximal phalanges, but the most medial one attaches to the medial side of the base of the second, because as the digit in the median plane, the second toe can only abduct, so it gets 2 dorsal interossei. Just draw back in the plantar interossei and the other muscles responsible for abduction and adduction, just to show how they work for all the digits. Ta-da! It's probably worth pointing out that abduction and adduction in the foot isn't a particularly useful movement, just as it wasn't in the hand, but that when all these muscles contract together, they produce flexion at the metacarpophalangeal joints and extension to some degree at the interphalangeal joints, but that when combined with the strong flexors of the toes, it aids in overall flexion. It means that the foot can be used to grasp things. That's not so useful, again, in humans, but it is more in the climbing primates. In humans, of course, we can use these muscles to pick things up off the floor without having to bend over sometimes. If we remove now the dorsal interossei, we can see that there are muscles even further dorsally. That's because, unlike in the hand, there is a dorsal muscular compartment of the foot. So we'll turn the foot over to see those muscles. And here we can see them with the tendons of the long extensors still in place. Just to review, that's tibialis anterior, extensor hallucis longus, extensor digitorum longus, aeroplane, and fibularis tertius, tucked in here, all passing beneath the superior extensor retinaculum and then the inferior extensor retinaculum. So if we remove those tendons and retinacula, we can see here our 2 muscles, which look like one, but this is extensor hallucis brevis, and this is extensor digitorum brevis. They all arise from this area of the calcaneus, just at the entrance to the tarsal sinus. Extensor hallucis brevis attaches to the base of the proximal phalanx on the extensor surface, and Extensor digitorum brevis has only 3 tendons that attach to the dorsal surface of the base of the 2nd to 4th digits. The 5th digit, the small toe, doesn't get a contribution from Extensor digitorum brevis, which is a little sad. However, we can always cheer ourselves up by turning the foot a little to have a better look inside the tarsal sinus, which is always a happy experience. That's almost everything you need to know about the muscles of the foot. There's more information and some tables in your books. Next time we'll look at the lumbar and sacral plexuses and the lumbosacral plexus, which isn't anywhere near as tricky as the brachial plexus, so that is a bit of a relief. Until then, ka kite.